Hello everyone, this is Community Health Nursing audio lecture from Pharma College and I am Mr. Fasiga. So at today's session we will see chapter 1, which is the introduction part. So at the end of this chapter the student will expect at least to define what is community and define health. Also they expect to describe health models, different health models, and finally they will expect to define community health nursing. So at the end of this chapter at least they expect to familiar with these four core concepts. Starting from the community. Community is a collection of people who interact with one another and whose common interests or characteristics gives them a sense of unity and belonging. So one gathering of people to be said a community, the people must interact with one another and whose common interest gives them a sense of unity and belonging. The function of any community include a sense of belongingness and shared identity, value, norms, communication, and supporting behaviors. When we say identity means the characteristics, feeling, or belief that distinguish that community from other community. So when we say value means a belief about what is right and what is wrong. When we say norms means a pattern of behavior that is usual or expected from that community. There are three features of community. One community must fulfill these three features. The first one is location, the second one is population, and the third one is social system. So when we say location means the existence or a specific geographical place that the community existed. Sometimes the health of a community is affected by its location, including the placement of the service or the geographical feature. If we take some, for example, some community living around desert area, we expect in that community what? Malaria. So the location of that community affects the community health. So the other one is population. Population means aggregate of people that live within the community. And the other one is social system. Social system means the various parts of community. Maybe it is health system, family system, economic system, and educational system. So one community must pass through these three features. The first one is location, the second one is population, and the third one is social system. For example, if we take our college, Pharma College, as example, Pharma College have its own location. The Pharma College located in Hawassa around Komboni School. So the other one is population. Population of Pharma College is the students, staffs, different staffs. የተለያዩ ስታፎቹ የፋርማ ኮሌጅ population ናቸው. The other one is social system, which is educational system. All the students must pass through this educational system. So we can take Pharma as a simple example for a community. The other one is health. WHO defines health as it is a state of physical, mental, and social well-being, in not merely the absence of disease or infirmity. Health in its holistic philosophy differ greatly from that of the acute care setting, which is acute care setting is intensive hospital care. They focus on relieving the signs and symptoms of the disease, whereas WHO defines health as a state of physical, mental, and social well-being. When we say physical, it implies a mechanistic function of the body. When we say mental health, it means that the ability to think clearly and coherently. Coherently means the ability to think in organized way and has to do with your thinking and feeling and how you will deal with your problem. Coping mechanism, how you will deal with your problem and how you will create a solution for that problem. Mental health also have two components. The first component is cognitive component. The other component is emotional component. Cognitive component means, as the name implies, it is the ability to learn, perceive, and think clearly. Whereas emotional component means the ability to express emotion, anger, happiness in proper way. Excessive happiness or excessive anger is it is a result of mental problem. So ደስታ ሲበዛም ሀዘን ሲበዛም ከሜንታል ፕሮብለም ጋር ወይም ከዲፕሬሽን ጋር ልናያይዘው እንችላለን. ሶ ፕሮፐር በሆነ ወይ ደስታና ሀዘን መግለጽ is a sign of mental health. So the other one is social health. This refers to make and maintain a relationship with others. So WHO defines as health as it is a state of physical, mental and social well-being. So the other one is health and wellness. Health in different personal perception differ from one person to other person. Some people describe their state of health as a good, even though they may actually have one or more diagnosed illness. That is because each person perceives health in relation to personal expectation and value. So that's why they express themselves even if they have one or two diseases. They call themselves I'm healthy based on their personal expectation. Wellness is a lifestyle modification. Wellness is a lifestyle that aimed at achieving physical, emotional, intellectual and environmental well-being. Thus, the use of wellness, the use of modifying your lifestyle from unhealthy behavior to healthy behavior, gives you or increase the stamina, energy and self-esteem, then enhance quality of life. By modifying your wellness, by modifying your lifestyle, you will achieve self-esteem. When we compare, for example, when we compare smoker and non-smoker, yes, self-esteemaቸውን የአጫሾችና አጫሽ ያልሆኑ ሰዎች self-esteem ኮምፔር ብናደርግ አጫሽ የሆኑ ሰዎች self-esteemaቸው ዝቅ ያለ ነው። ሰው አጠገብ ለመቅረብ ይቸገራሉ። ምክንያቱም ሲጋራ በሚያጨሱ ሰዓት የሲጋራው ነገር ጠረናቸውን ስለሚቀይር ከሰው ጋር ለመቀላቀል ትንሽ ይቸግራቸዋል። በዛው መጠን ከሰው እየራቁ ይመጣሉ። self-esteemaቸው እየቀነሰ ይመጣል። If they change their lifestyle from non-smoker from smoker to a non-smoker, they will increase their self-esteem and they increase their stamina and finally increase quality of life. So there are the other one is model of health. There are various model of the concept of health. One concept is says that some model are based narrowly on the presence or absence of definable illness. If there is absence of sign and symptom, the person called healthy. The other concept is based on more conceptual on health belief and wellness and holism. So the first model is clinical model. As the name implies, it focused on the absence of sign and symptom of the disease or injury. If there is no sign and symptom, the person called healthy as a clinical model. Albert Elden defines this. By the way, Albert Elden is a medical doctor, or he have a PhD, and he also called that the father of wellness. He published